Hi, Dr. Mark Agresti. I want to talk about the 10 drugs which cause the worst withdrawal in psychiatry. I'll go with Clonidine first. Clonidine is a blood pressure pill. It's also a pill that is used to treat opiate withdrawal. Oxycontin, oxycodone, hydrocodone, codeine withdrawal, heroin withdrawal. It's given in doses 0.1 milligram, 2, 3, 4 times a day. You could go as high as 0.2 milligrams 4 times a day. Once you've been on this drug for a while, you cannot stop it abruptly because it causes a rebound elevation of your blood pressure, which can cause heart attack and stroke. So it must be tapered slowly. Another drug which is used to slow the heart rate down is called Inderal or propranolol. This drug is used to treat blood pressure. But what is the problem? When you stop it, you can get a rebound, dangerous rebound, elevations in your blood pressure and cause heart disease or sudden death. There's an antidepressant out there called paroxetine, Paxil. It has a terrible withdrawal, uneasiness, restlessness, dizziness, thoughts of death, electrical shocks in your head, flu-like illness, nausea, stomach pains, feelings of not being real, disorganized. It is the worst antidepressant for withdrawal. I would give that and one of my other drugs on the list, Effexor, the two, which is a very similar withdrawal, phenlafaxine. These two are the worst for antidepressants. They may work as antidepressants, but both paroxetine, phenlafaxine are the worst when it comes to withdrawal syndromes. Absolutely horrid. Effexor, phenlafaxine, which would be 5, can cause a terrible withdrawal syndrome, dizziness, lightheadedness, not feeling real, electrical shocks, vomiting, nausea, tremor, uneasiness, malaise it's called. Very dangerous. There's a class of drugs which all have a withdrawal, benzodiazepines, Ativan, Xanax, Dalmane, Halcyon, Clonidine. They all have withdrawal syndrome. But the worst in this class, which is the absolute worst, would be alprazolam, Xanax. If you stop it suddenly and you've been on it for any length of time, usually more than a couple weeks, but people who've been on it for 6 months, a year, are definitely in trouble in terms of its withdrawal. Xanax causes grand mal seizures, potentially death. It is extremely dangerous. The next one would be Topamax, topiramate. Once you're on it, you cannot abruptly stop it. It may precipitate seizures. You may have a seizure when you stop it. Gabapentin, Neurontin. It's used commonly for neuropathic pain. What does that drug do? That drug causes, if it's stopped abruptly after you've taken it for months, confusion, sweating, stomach problems, nausea, vomiting, diarrhea, loose stools. So that one cannot be stopped abruptly. I've had people get almost delirious from stopping it. There's one called prednisone, which is given to asthmatics or people with rashes. It is a steroid, and it needs to go up and come down slowly. Otherwise, you can get nausea, vomiting, diarrhea, abdominal pain, weakness. Also on the list, of course, as we know, opiates. Heroin, OxyContin, oxycodone, hydrocodone, codeine, methadone, Dilaudid, fentanyl. They cause a withdrawal syndrome. All these drugs usually last 5 to 6 days. Kicking, abdominal pain, sweating, loose stools, vomiting, diarrhea, itching, goose flesh, hot and cold spells. So opiates are pretty bad. Everyone knows that. Baclofen. That's a muscle relaxant, and once you're on that, stopping it suddenly can cause confusion and delirium. Also of special note, there may be problems with coming off lithium, and the older generation antidepressants like nortriptyline, amitriptyline, diazepamine, and ipamine can cause problems coming off. They're very old, not really used, so I'm not going to talk much about them. Lithium, another one which, if you've been on it for years, can have problems coming off. And there are some obvious ones like alcohol. If you're drinking a lot, you cannot come off it abruptly. You can have delirium tremens, which is confusion, disorientation, and seizure and death. Barbiturates must also be mentioned. They're currently in migraine medicines. And these barbiturates can cause sudden death when stopped abruptly. Butalbital is the most common one. It's in migraine medicines. But people use phenobarbital, Seconal are commonly used, less so, but I think people abuse animal medications, and these can be in dog medications too. Thank you, Dr. Mark Agresti.